So here we're going to see the wax trial of the denture. For that, a careful and thorough checking of various factors of the trial denture is important. The patient should be encouraged to express his or her opinion. So trial insertion is a most critical step in the complete denture fabrication, and it is the last opportunity to correct the errors before processing the denture. So we have a list of things to be verified in the wax trial. First we have to insert the trial denture. First I am inserting the upper denture. Now I am placing the lower denture and stabilizing both the dentures. Now the first thing to be checked is the midline. We have to check the midline of the tooth coinciding with the midline of the face. So for that we have to see this is the midline of the face. So it has to coincide with the midline of the incisor, the central incisor. So it should be centered in the philtrum. So the midline of the tooth should be centered in the middle. So now you can see that the midline of the philtrum coincides with the midline of the central incisor, upper central incisor, and the midline of the upper central incisor coincides with the lower central incisor. So the midline coincides with the facial midline. Sometimes the frenum can also be used to check the midline, but in case of deviation of the frenum, the facial midline has to be taken into account. So in this patient, the frenum is not deviated, so it can be used as a guide for the placement of the midline. So you can see that the frenum coincides with the midline of the tooth. So once the midline, if you see the midline of the central incisor has to coincide with the center of the philtrum, and the midline of the upper central incisor should coincide with the lower central incisor. So you can check this with the scale. So all the three are in the same line. So the next thing to be focused is the centric relation. So when a patient opens the mouth and closes in the centric, so when you retract the cheek, you have to see that all the posteriors are in constant contact with each other. So when so now if you see, all the posterior teeth are in contact. So similar way for the right side also you have to see. So this can be visualized with the mouth mirror. So you can use a mouth mirror to check this. So all the posterior teeth are in a simultaneous contact. So the second thing what we have to check in the wax trial is the centric relation. So we have in centric relation what has to be checked is the constant contact of the posterior tooth. So the patient should be asked in the posterior most position, he should be asked to bite swallow the saliva and bite. So now we have to check the contact of the posterior teeth. Now I am asking the patient to swallow the saliva and bite the tooth. So now if you see when after retracting with the mouth mirror, you have to see that all the posteriors to be in contact, simultaneous contact. So similar way, when you move the mouth mirror to the other side, you have to see that all the posterior tooth are in a simultaneous contact. There should not be any gap between the tooth. In case if there is any discrepancy or gap between the tooth, it means that the centric relation is wrong. You have to redo the centric relation or increase the tooth accordingly. To show clearly the centric relation, I have used the cheek retractor. Now you can see the simultaneous contact of the posterior teeth. When you see this side, it is all in a simultaneous contact. It is clearly visible, and this side also it is clearly visible. So this is how it should be in the centric relation when the patient is biting. So any discrepancy here is a mistake in the centric relation, and you have to repeat the teeth setting. So the next factor to be assessed is the extent of the PPS, posterior palatal seal area. So for that we have to use this T-burnisher. So the ball end should be placed over the palatal surface, and this end should be over this buccal surface. So you have to place this on the, it will be like a T shape, and you have to place this over the crest of the ridge, and you have to slowly move this, and at the point you will see a depression. So that is nothing but the hamular notch. So both the side you have to mark this extent. Then you have to join this side to this side with the then you have to ask the patient to say ha in a short vigorous burst. Ha solunga.
Ha.
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 So you can see the depression or the demarcation between the hard and the soft palate. So that area you have to mark with the indelible pencil. Now I have marked the extent of PPS with the procedure which has been already mentioned. Now after marking with an indelible pencil, I am removing the cheek retractor and inserting the upper denture.
ஒரே நிமிஷம் சாரி எடுத்துங்க இது வந்து இதாகிடுச்சு.
And pressing it in the posterior region so that the PPS, the line which I have marked, will be reproduced on the posterior surface of the upper denture. So once after few minutes I am removing the upper denture. So now if you see, the line has been reproduced in the upper denture. So this shows that the posterior extent has been correctly recorded in the primary in the secondary impression, and no need for correction of the posterior seal area. So the third thing what we have to measure is the vertical dimension of occlusion, and this vertical dimension of occlusion is nothing but the height of the lower face at occlusion. So we have already measured the vertical dimension of occlusion and vertical dimension of rest in jaw relation. So we have to verify whether the values are coinciding with this value. So for that we have to repeat the jaw relation, vertical jaw relation procedure. So have place the plastries in the tip of the nose and the tip of the chin. So we have to measure this distance, and we have to verify with the vertical dimension which has been already measured. So for that, so I am using the divider to measure from this tip of the teeth to mark to this point the patient at occlusion I am measuring. So now I will check with the scale the measurement. So it is approximately 60 mm. So now I have to check with the previously measured thing. The third factor to be checked is the vertical dimension of occlusion. For that we need this positioning of the plastry. So it should be placed on the tip of the nose and tip of the chin, and divider is used to measure the vertical. The patient is asked to bite the denture, and the distance between this T and this T has to be measured. So I am using this divider to measure this distance. So from this point to this point I am measuring. So it is approximately 60 mm. So in the jaw relation we have already measured the vertical dimension at rest and vertical dimension at occlusion. So this occlusion should coincide with the vertical dimension of occlusion obtained in the jaw relation procedure. So it is more or less equal to this 60 mm. So this verification of vertical dimension is also over. So in case this is vertical dimension is nothing but the height of the lower third of the face. In case of this discrepancy, what happens? The lower face, when the vertical dimension is increased, the lower third of the face either increases and become elongated, or when the vertical dimension is decreased, it will become shortened, and many problems will occur. So we have various errors and problems due to this vertical dimension, so it has to be followed correctly. So the fourth factor to be assessed is the lip support. So this is the lip support. You have the nasolabial fold and it should not be obliterated. So this is because of the labial flange. The labial flange should be properly contoured for the proper lip support, and it gives the natural appearance for the patient. So the fifth factor to be seen is the buccal corridor. So the buccal corridor is nothing but the space between the buccal surface of the posterior teeth and the cheek. So this black triangle, this color, this is known as the buccal triangle, and it should not be increased or decreased. In case if it is increased, it will be like full of tooth appearance, and if it is decreased, there will be a no tooth is present in the posterior region. So this buccal corridor should not be increased or decreased for the aesthetic of the patient. Then the sixth thing to be assessed is the phonetics. So for that, the patient should be asked to speak certain words, pronounce certain words. Like you have to ask the patient to say like from 60 to 70.
60, 61, 62, 63, 64, 65, 67, 68, 69, 70.
Patient pronounce from 60 to 70 and the word Saraswati and all. There should not be any contact present between the upper and the lower teeth. So this is the ideally requirement. If it contacts, there is the vertical dimension of occlusion is too great and it need to be reduced. So if a patient is saying the yes sound is not, it should be clearly visible. Yes, Soluna?
Yes.
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 So it should be clearly visible. There should clearly heard. So there should not be any whistling or central lisping of the yes sound. Yes, Soluna sir.
Yes.
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 So the seventh factor to be assessed is the overall appearance. So in the overall appearance, what we have to see is the size of the tooth. So it should be selected according to the facial shape and position of the tooth. It should be placed on the ridge crest and form and the arrangement. It should be all in aesthetic and functionally எப்படி இருக்கு உங்களுக்கு பல் செட்டு எங்கேயாச்சும் கடிக்கிறதுக்கு எல்லாத்துக்கும் கரெக்டாக இருக்குங்களா பார்க்கறதுக்கு and the most important is the patient approval and it should be done after the cleaning and neatly festooning of the wax trial denture. Any excess wax on the teeth should be removed so that the patient can clearly visualize the final appearance which will be on the after complete denture fabrication. So the patient is provided with the mirror to view the arrangement of the teeth. So கண்ணாடி வச்சு பாருங்க எல்லாம் கரெக்டாக இருக்கான்ட்டு. ஏதாச்சும் மாற்றணுமா? So at this stage you have to ask the comment of the patient and any objection. So if there is any objection, you have to correct it immediately wherever possible. And at this stage you can also have a try-in with the family members, so that because of the criticism it is better at this time after approval. So once the approval is being given by the patient, the next it is proceeded to the next step.